Title: Asthma. Opening: how much do you really know about asthma? Today we delve into this common respiratory condition. Asthma, a word we all have heard of, but what exactly is it? It's a chronic inflammatory disorder of the airways. This means it's long-lasting and often comes with inflammation in the respiratory tract. But what does it do? Well, it results in episodes of reversible bronchospasm. In simpler terms, it leads to spasms in the bronchi of the lungs that can be reversed. This disorder is also associated with reversible airflow limitation and airway hyperresponsiveness. This means that the flow of air in the lungs can be limited, but this limitation can be reversed. Also, the airways tend to react strongly to various stimuli, be it from within our bodies or from the environment around us. Closing. Asthma is not just a disorder, it's a journey that many navigate daily. Let's explore this journey further. Asthma is more common than you might think, affecting a significant portion of both adults and children. Picture this. In a room filled with 10 adults, chances are at least one of them has asthma. And if you're in a classroom with 20 children, you can expect that between 2 and 3 of them are living with this condition. Interestingly, many children with asthma see their symptoms significantly improve as they navigate the tumultuous journey of adolescence. But don't think you're off the hook if you didn't have asthma as a child. Asthma can strike at any age, and it often runs in families. So if your parents or siblings have asthma or related conditions like allergic rhinitis or eczema, you might want to keep an eye out for the telltale signs. Occupational asthma is another form we see caused by allergens in the workplace. Asthma, it seems, is everywhere we are. Understand the why behind asthma, and you're halfway to managing it. Now let's delve into the pathophysiology of asthma. It's essentially a story of airway obstruction leading to an imbalance in the ventilation-perfusion ratio, which in turn leads to hypoxemia. This low oxygen level in the bloodstream triggers an increase in ventilation, causing a rise in the partial pressure of carbon dioxide. This cascade ultimately results in an increase in pH levels and muscle fatigue. As this situation continues, ventilation decreases, and the partial pressure of carbon dioxide increases, further raising the pH levels. Now, onto the triggers of asthma. There are numerous triggers, and these can vary widely from person to person. Upper respiratory tract infections, allergens such as pet dander, house dust, and molds, irritants like cigarette smoke and air pollution, certain drugs like NSAIDs and beta blockers, preservatives such as sulfites and monosodium glutamate, and even emotional stress or anxiety, cold air, exercise, and gastroesophageal reflux disease can all trigger an asthma attack. The signs and symptoms of asthma are also quite diverse. The most common ones include dyspnea or difficulty in breathing, wheezing, chest tightness, cough, particularly at night, and sputum production. Asthma symptoms can be paroxysmal, meaning they come and go, or they can be persistent. During an asthma attack, signs of respiratory distress, such as rapid breathing, use of accessory muscles for breathing, and cyanosis may be evident. Pulsus paradoxus, a decrease in blood pressure during inspiration, can also be seen. Understanding the pathophysiology, triggers, and signs and symptoms of asthma not only helps in the management of the condition, but also aids in the identification of potential triggers and the implementation of preventive measures. With asthma, the triggers are many and the symptoms varied. It's a condition that demands our understanding and attention. Diagnosing and treating asthma is a multi-step process, tailored to each patient's needs. To confirm a diagnosis, several investigations are carried out. Oxygen saturation is measured to assess how much oxygen is reaching the tissues through the blood. Arterial blood gases, or ABGs, are also considered, particularly in acute exacerbations. ABGs can reveal decreased oxygen levels during an attack due to ventilation-perfusion mismatch. In mild asthma, carbon dioxide levels can decrease due to hyperventilation. However, normal or increased carbon dioxide levels are an ominous sign, indicating the patient is no longer able to hyperventilate due to worsened airway obstruction or respiratory muscle fatigue. Pulmonary function tests, or PFTs, are conducted when the patient is stable. These tests measure how well the lungs work, including how much air they can hold and how quickly one can move air in and out of their lungs. Specific criteria, such as a decrease in the ratio of the volume of air exhaled in the first second to the total volume of air exhaled, are used to diagnose asthma. Once diagnosed, treatment is multifaceted. It begins with avoiding known triggers and educating the patient about the disease, treatment goals, and self-monitoring. Pharmacological treatments play a key role, with medications like short-acting beta-2 agonists and anticholinergic bronchodilators providing symptomatic relief during acute episodes. Oral steroids can be added, along with a long-acting beta-2 agonist for severe cases. Long-term prevention involves inhaled or oral corticosteroids, anti-allergic agents, long-acting beta-2 agonists, methylxanthines, leukotriene receptor antagonists, and anti-IgE antibodies. It's crucial to regularly reassess the patient's control over their asthma, their inhaler technique, adherence to medication, exposure to triggers, any coexisting conditions, and the presence of certain cells in the sputum that indicate inflammation. Effective treatment of asthma requires a comprehensive approach that addresses not just the symptoms but also the underlying triggers and patient's lifestyle. When faced with emergency situations, quick and effective asthma management becomes crucial. The initial shield is the utilization of an inhaled beta-2 agonist, dispensed through a metered dose inhaler accompanied by a spacer device. This method is effective in swiftly soothing the muscles within the airways, enabling more comfortable breathing. Systemic steroids, consumed either orally or intravenously, are subsequently used to diminish inflammation present in the airways. If the situation escalates to a severe level, anticholinergic therapy is integrated to further ease the muscles surrounding the airways and reduce mucus production. The administration of magnesium sulfate may also be considered, as it aids in muscle relaxation within the bronchial passages and enhances breathing. In circumstances where lives are at stake, rapid sequence intubation may be employed to secure the airway and offer mechanical ventilation. Asthma, although complex, can be efficiently managed with proper understanding. Remember, acquiring knowledge is the initial stride towards control.